outside. So we keep it there and students should go take and come. Now we don't have all those facilities, but tell them that it is in the hospital, it is always from the fridge. Okay. So all injections, your needles, then alcohol swab, all what you need.
Let them learn and go and take it in the drawer as a fridge.
We can use that, but tell yes.
So
we can write that refrigerator and put it. Yeah, we want to do it. If you want to make those things as refrigerator, please put a label over there. Okay. So all these things are there, and anything I need from. Okay, when I come to intradermal and all, I need it. Now I should have my always for injections. Remember, first you don't go to the patient also. First should be MAR. Okay, because you should know whether it is time for you to give the medications or not. You need to read from the MAR, even if it is IM or everything. First you should know the action. For that sake, the student should read the MAR. Okay, now I read that it is regular insulin, act rapid, and subcutaneously it should be given 3 times a day. But they have said only follow sliding scale. And my patient's blood sugar level was 18. So I should check. Where 18 comes, it is 10 units. Okay, some students know 18.1 they will see and they will say 12 units. That's why we keep it in that border, so that they should be careful. Okay, so 18 is 10 units. Okay, so we decide about it. Somebody had given it in the night, morning dose is not yet given. You make them always document it in the middle, because it's always difficult for them. Okay, always we are in the daytime only, so make them document it here. Okay, so I'm reading, I know what is insulin, I know about the side effects and everything, then I go to my patient. Okay, when I go to my patient, imagine I'm not going to all the steps, if you are okay. Okay, wash your hands, provide privacy, and then verifying the patient is very, very important. First identification. Always remember, for all the medications or injections, it is 2 identification. Okay, so I'm identifying the patient. I'm asking him, where was your last time. So if he is asking, okay, other side or abdomen, wherever he is asking, I'm assessing that site, which is very important. Okay, assessing, as I said, whether there are any lumps or if it is very hard. See, if it is going to be a hard area, somebody has given again and again, the medicine will not be absorbed at all. So we need to go touch the patient's hands and then assess whether everything is fine. Okay, or any lesions or any discoloration. Then tell the patient that the blood sugar is this much, the doctor's order for you is 10 units, because most of the diabetic patients know they are taking at home. So you need to give the instruction. Is your food ready? Okay, remember, if they don't ask, we should reduce mark, because without seeing that the food is ready, we do not give insulin, because hypoglycemia is very common. Okay, so you tell them, check for all those things. Okay, I will go prepare my equipments and then come back to you. Okay, if you want, you can do position at this stage itself, or you can do later also. I prefer to do position now, because once we wear gloves and when we are ready to do things, it is difficult. Okay, what position we want to do? If you want to give it in the hand, put the patient in Fowler's. If you want to put it in the abdomen or thighs, the patient can be in supine. Okay, so we will go ahead with Fowler's position, because I want to put it in the arm, and my patient said they have given the last dose in the left hand and I want to give it in the right hand. Okay, patient is ready. Now I come back. From this step, I need a second nurse. Okay, my second nurse will check with me. First check here. Okay, it is going to be different for subcutaneous and IM. Okay, all 3 checks will be done and everything is prepared for IM injection here. But subcutaneous, only first check is done over here. Then second, third, everything at the bedside. So the second nurse also is there with you throughout. You are getting my point? Okay, there is a difference over here. Students will learn correctly, but when they come for the exam, they confuse the whole thing. They will do all upside down. That's why we always separate. Subcutaneous one day, IM another day. Okay, so first check, as you said, if you want, you can keep it in the refrigerator. Take the nurse with you and go over there, and they have to imagine I have gone to the fridge and I have come back. Okay, they need to read carefully. Okay, regular insulin, and it is 100 units per ml is available. Okay, here also it's written. Then I'm going to, because it is blood sugar is 18, I'm going to take 10 units. Expiry date also they have to see. It's not expired. Okay, so what all they have seen? Name, the units which are available, how much I need to give for my patient, they are saying, and the expiry date. 4 things keep in your mind. Okay, they should never miss any one part also. First check is over. Now the student is going to collect all the things because she has to go to the bedside of the person. I'm taking the N also so that I show along with that. Okay, that's why I'm taking 2 syringes. Okay, these are the syringes. Okay, we have 100. In between there was 50 also was coming. 100. Okay, 100 units. Okay, why this is designed 100? You can explain it to the students. See, this also 100 units in 1 ml. Okay, so patients are taking at home. So the companies have made it easier. 100 divisions are there for 1 ml. This is 1 ml syringe. So if the doctor is saying 16 units, you just take 16 number. That's all. No calculation at all for any insulin. To make it easy, so let students also learn that. It is very easy. Whatever is the number which is ordered, you take that many divisions because these both are made for each other. Because patients are doing it at home. Okay? So collect all these things. What are all the things I need? I need a cotton. I need 2. Okay, I will tell you why. I need 2 alcohol swab. Okay, gloves I need. Anything else? My hand wash. And always, if kidney trays are available, please take 1 more. Because all the yes, test box. And also sharp container. See, in the hospital also, for students to take it to the bedside, they have small sharp containers. So we should insist they have to take it to the bedside. Okay, so everything is there. Now I go to the bedside. Second, third check I will do it there. Then I am going to give to the patient directly. Okay, the second one also is coming with me. So when I come back, I should remember to do the re-identification. Okay, because it is medication. Second time I am verifying my patient's identification. Okay, sir, I have come back. Okay, so say all those things. Then re-identify. Okay, you are getting ready with your medications. You can wear your gloves now. Okay. This stage also you can do position, no problem. It's not wrong. If you forget in the first one, you do the position now. Just to not to not to waste time. No, I just did it. Yeah. And all these patients are mostly conscious and they are fine when we are giving regular insulin. So it is just
they just wake up like that and sit.
Yes. Actually, they will be waiting for you to give because the food has come already and the students will be slowly taking. This is the what reality. Okay. So second check I am going to do. Before that, injection pad. Sorry, we will not be. Just open that. On oval shape that pad. Yes. Oh, I forgot about it. Okay. So if it is in the abdomen, they can tie it around the abdomen. Okay, if it is in the hands, they are going to. And at this stage, make the students tell you about the location. Okay, they should know. Acromion process, Wally-Crennan process, and dividing into 3. So it should come here, it should be in the outer area. Okay, all those things they should.
So like in the exam, one of the processes is for them to ask the patient. The teacher will not prepare the area.
No, they have to. They have to prepare. Okay.
After asking.
But the teacher is answering. For example, you feel you want them to do it here. So when the student is asking where was the last time injection, they gave it in the abdomen. I want it in my right hand. All that it is the teacher who says.
They want to fix this.
Yes, and some students you say I want it in the abdomen. So you see whether they are doing the position properly, supine, and then whether they are able to understand. So you can change. Okay, it's according to the situation. Okay, then see if I open everything and do it. Okay. Let me do the second check, but I want to clean the patient and I want to keep the patient also ready. Okay. I'll just open. I'll maybe check in check. Okay, Kulu, imagine Kulu this here. So we are doing regular insulin 100 units per 1 ml and patient sugar level is 18. That's why I'm giving 10 units.
Yeah.
Okay, and it's not expired. All 4 things each time you are doing. Okay, second check is over. After second check, I'm just keeping things ready. Okay, you see what all I'm keeping ready. You can even open this and check the expiry date. When you are collecting also you can check, or you check it here. Okay, it's not expired. If it is open, we can keep it down also, nothing will happen till you open others. Why we ask them to open? Some syringes may be stuck. So just to check whether it is functioning and for them to learn, okay, I'm going to take 10 units, so where it is. Okay, they should, for all those things they can see. Okay, then when I want to take the medicine, I don't have time to go clean the patient. Okay, I have my syringe already in my hand. So finish all the rest what you need to do with the patient first. Okay, I need to clean the site in a circular motion from inner to outer. Okay, just go at least 2 centimeter or 5 centimeter around the wound. Not the wound, the side.
This side.
Okay, so just once from middle, just go round like
Once,
this.
yeah.
That's all. Okay, now let it dry. Because whenever alcohol is there, if we are going to give injection, they say it stimulates bleeding. So we are not going to do it now, let it dry. By then we will get ready. Now why did I take 2? Because I want to clean my vial also. Okay. If there are 1 vial, okay, clean it like this nicely from center to outside. If you have 2, just turn it the other side and use it. No need to waste 1 more. Okay. And 10 units. Now once they remove, they can never recap. Okay, please instill in their mind, no recapping, no recapping, no recapping, because that is the policy of our hospital. And also needle stick injuries are avoided. When you saw me opening, no struggling to open like this, just pull it out like that. That is the best method. Then take, always when you want to withdraw from the vial, you should take air equal to the amount you want to withdraw. So it is just 10 minutes.
10 minutes.
Okay, push it inside. When you are pushing it inside, keep it in this direction. Then when you want to take it, okay, ideally they should hold like this, let it be supported in the arm. But if they don't know, they want to do like this in different way, no problem. Better to keep it at the eye level. Okay, medicine started coming on.
We push the air, then we
Yeah.
draw the medicine. And we have to make sure the medicine level, maybe the vial remaining little only.
Yeah,
So-
the problem is there will be lot of air
Adjust.
coming. The students should know they should never take the air, so they should push it back inside whenever they are getting
Yeah.
air.
Yeah.
And my second nurse also should check that. It is 10 minutes. Okay. Once, see, can I recap now?
No.
You understand now why I did all the cleaning, preparation,
Yes.
everything. Now with this in my hand, I'm making it very careful not to poke anybody near to me. Then the third check. This step everybody forgets.
Third check.
Because even if they don't do 1 check, we can fail them. But so many times we are gracious with them. We ask them, is everything done? Then they remember. But please, when we are practicing, if we tell that to them, then they will remember. So check the third check. Regular insulin, 100 units per ml, it's available. Because the sugar levels are 18, we are taking 10
not
and
expired.
not expired. Okay. Now I go to my patient. I need to have cotton, because at the end of it, usually we tell them to keep it in this finger, which we are not using. Okay, this is my non-dominant hand. I'll show you in both angles. Okay, imagine my patient is very thin. So whenever I want to give in 45-degree angle, see how I'm holding the syringe. Okay, it is easy if I go like that. And some students will try to pinch like this and do. Please don't encourage that. Pinch from above, give from down. It is very easy.
Yeah.
Why they
Smoothly
should start?
will go, yeah.
See, pinch like this.
And the sharp
See the
side,
this is
yeah.
45-degree angle. Okay. Go inside
Yeah.
like this.
Shaft
You
looking
see
down.
my hand. Now I need not pinch anymore because I'm very sure I'm in subcutaneous. leave this hand.
Support.
Thumb will hold this syringe. Then push the medicine. Okay, teach them this technique.
1, 2, 3,
Okay,
4.
all these are very hard. Medicine is not going inside. Okay, after finishing, wait for 5 seconds. For subcutaneous, only 5 seconds. So let them count. 1, 2, 3, 4, 5. Okay, keep the cotton and remove it. Why we are keeping the cotton? So that the skin is not pulled back.
Yeah.
That is the reason. Okay, now if I want to give a 90, see how I am
The
holding.
pen.
This is
The pen
easy.
method.
Okay, like a pen. I think some other ways it's very hard. Okay, hold like this, pinch like this, go in 90, hold the syringe, just give it. No aspiration, they should remember. No massage also, they should remember. Okay, why no massage? If we massage, the
Faster.
absorption will be faster.
Yeah.
So we do not want that to happen. Just keep the cotton and remove. We are not doing anything else. Okay, at least in IM we will say press nicely for some time. Here even that is not needed. Got it? So once they finish, immediately the first thing is throwing this. Second thing is putting the side rail and putting the patient proper. Then only replacing all their things. Okay, let them follow the steps correctly. So, okay, sir, are you alright? We have given the insulin. I want you to take your food now. If you don't take, you can have low sugar and you can say the symptoms. Okay, dizziness you will have, sweating will be there, or after some time I will come back to you. Okay, if you have any problems, you can inform me. These things are all very important in insulin administration. Okay, imagine now two I need to give. Okay, I am not following all the procedures. Follow everything else like the same. Do you want me to show it in the abdomen? Yeah? Abdomen always 90. You need not think of 45 at all. Only in the hands, we should think whether we need to give 45 or 90. Even a thin person will have enough subcutaneous fat in the abdomen.
Yes,
So always 90 degree. Okay. Okay, so 10, 10, 10 plus 10 we are going to give. Okay, so follow all the other steps and then make the students fix this very well. Okay, if you want them to show you, you can tell them this is navel. So 2.5 centimeter they should not give. Last dose was on the left side. So now we are going to give on the right side. Okay, all that you can make them explain. And it's better to fix it this direction, not like this. So you can see that they are fixing. Simply hold it for me now.
Okay.
Okay, cleaning everything same. Okay, I'm going directly to the procedure. 3 checks, everything should be done. Okay, now before that, one is, you can see the cloudiness. Yeah, powdered. One is cloudy. Always N is cloudy. Okay, this regular is clear.
Clear.
So you should make them remember something. Whenever we are taking clear before cloudy. Okay, you
The
understand?
sky is clear,
Yeah.
then it's become cloudy.
However they want to remember.
Yeah, that's what I
that
told
would be
them.
better,
I
Yeah.
usually tell them, even
Yeah.
in the midnight,
Yeah.
if we wake you up and ask you, you should remember
Yeah,
this.
clear
because-
before cloud.
Okay, and students have lot of questions when we do this procedure. They
Yes.
ask us,
Air first.
why not? Why? What is
What
it?
is the-
Okay, even I'm not with that fully, because see, you're saying that you're taking clear first, then you're going here, because you do not want any of these particles to come over here. But you are mixing and giving it to the patient, nothing is happening, no. So I'm not telling all that to the student, but the company says this cloudy insulin should never mix with the clear one, because it seems it can change the potency of this medication. That is the reason they do like that. Okay, by mistake, instead of taking 10, they took extra. First one is okay, they can push it back. When they want to withdraw from the next one, they cannot push it back. They have to
Because
discard
it is
and start the procedure from
All
the
over,
beginning. Okay, remember that. Okay. So now it is 20 units. So I take air 20. Okay. After taking 20, okay, cleaning and all should be done. See, I need to take from this first, clear before cloudy. But when I push air, other way round. Okay, I always push air inside cloudy first. You see why? Then you will understand.
Yeah, later you cannot push it.
Yes.
Yes.
So only 10. Okay. Then come back over here. Push it. Immediately I'm just taking it. You understand why I pushed air there first? So that once I finish, I'm withdrawing 10 from here. As I said, if there is a problem, if you have taken extra, you can push it back here,
Yes.
but not in the other one.
Yeah.
Finished? Now I
Very careful.
okay, take only 10. In the sense, total should be
And
20.
without
20.
Yes.
And you cannot do anything.
Very tricky.
Yeah. After that's why we give this
The
for
third
exam.
check again.
Okay, now is the third check. Then you have already cleaned, you imagine. And 90 degree we are going to give, but still pinching is needed. Pinch, give a 90, hold the syringe, then give medications. Okay, after you give, you need to wait for 1, 2, 3, 4, 5. I do not take my cards. Okay, your cotton should be there so that you are just removing. Cotton is not for cleaning or not for pushing the medicine or anything. See, when you are pulling it out, the skin is also coming just to prevent that and reduce pain. That's all. So remember, they should keep it, then remove it. Okay, immediately they should throw it. Talking about food and all to the patient is important. Any doubts in this? Okay, just show me that hair pattern.
I have a question.
Yes.
For the sharp pen, they're saying, but the companies or hospital, they're taking it by weight and they're paying a lot of money. And they say only to throw the needle, not the full
No,
syringe.
this one,
So
this one, no
cannot
other
be
no.
detached.
We cannot detach.
they cannot. We cannot.
When we come to IN, I will show you how we get. See, these areas are all for detaching the needle separately. But it's not easy during exam for the students. So we allow them even if they throw.
Throw all
No, we teach them, they can
How to
unscrew it and throw also. But if they do not know, let them not waste time in that. No problem, let them. What else to do?
Unless they do the procedure well, allowed.
Okay, so this is the pre-filled syringe. Heparin is always pre-filled syringe, and you will find that 4000 units is 0.4 ml. Like that, you will find 0.8 ml also. So you just have to, they don't need to do fixing, anything is not there. Just clean it, always given in the abdomen. Okay, they say abdomen, it is better absorbed. That is the reason they are giving, the companies. Okay, now, what is the, shall I show one? Because this technique is different. But please do not mix it for the other technique, insulin technique. Okay, you will find there is one air bubble there. Okay, do you see that air bubble? According to the company, the air bubble should be also given. We are not supposed to give air bubble for any medication,
Yes.
but only for heparin. You need to give the air bubble at the end of the medication. That is to seal. They don't want even some medicine to come out. Okay, so keep it like this so that the air bubble goes up, and remove it this way. When you are going to give, pinch it 90 degree only, always in the abdomen. So you go like this with one hand you are supposed to give. That is the technique which we use here. This is not used for insulin. Okay, because again the company's instruction is throughout the injection you should pinch. Whereas we don't need that step for insulin. Okay, let us not confuse it to the student. They are not going to do this, but just when you are demonstrating, you be very clear so that when they go to adult one, they are clear about it. Okay, so go inside, see my hand. I just push it with my hand. Okay, continuously it should go. And the syringe also is not very long, so with my hand I can manage. Again, cotton should be kept and take it out. All the rest are same. So throughout, this pinching should be maintained, and with one hand technique you are going to give heparin. That is the difference. Okay, so we wasted one. Very few only we have.
Expensive.
It's very expensive. I saw 6 real or something.
Yeah.
No?
They
For
provide
the
the expired one with that.
yeah, they have given expired.
Expired only.
That's already expensive.
Any doubts in subcutaneous? Subcutaneous we have 3. Okay, but 2 we are practicing. Enoxaparin just teach, that's enough. No need to practice. Regular and mixing, please explain it to them clearly so that they will do better. Okay, we'll go to IM.